Good evening and welcome back to Mystic Matters. We are the Greater Mystic Chamber of Commerce. Good evening, Tricia Walsh.
Good evening, Suzette.
So we're gearing up for Art Festival, I guess.
We are always gearing up, actually. We start gearing up in January for Art Festival. Now we're in crunch time for Art Festival. So August 9th and 10th, you can check out our website, mysticchamber.org, for more information. If you're interested in volunteering, attending, we would love to have you in any capacity. And then right after that, we have the Downtown Mystic Sidewalk Sale, which is the following weekend. Right. And that's the time to get all your steals and deals. And so
even do a little bit of Christmas shopping. I know everybody's saying Christmas. I'm like, okay, well, for those of us in retail, that's right around the corner.
Exactly, it is. When you plan event to event, it definitely is quicker than you imagine. But so lots going on. Come see our beautiful downtown. It's looking really great. And there's a lot going on all over the place.
Well, you know what? In downtown, we have downtown Mystic, but we also have downtown Stonington, and then we have all of us in the middle, okay? And we have one great business that's right in the middle, and I'm glad to welcome back Megan Marco.
Thank you. Thank you.
Welcome back, Stonington Natural Health Center. And I should know that by heart because in the last couple of months I've been visiting quite regularly, and Megan, it's so nice. You're not new to the show.
No, I'm not.
And so you've been on quite a few times, and you are what exactly is your title?
Licensed acupuncturist.
If you notice, I let Megan say that, okay, because right before the show, I think Tricia and I were sort of practicing that.
Yeah.
But what does a acupuncturist do? So you had to get licensed for that. So
yes. So so you have to have a pre-med undergrad, and mine was in neuroscience, which brought me into wanting to know more about the mind-body connection, which then brought me to graduate school for acupuncture and oriental medicine, which is a 4-year graduate school, and I did that out in Portland, Oregon, at the Oregon College of Oriental Medicine.
Wow.
And I just have a passion for helping people get healthier and happier naturally with the acupuncture and oriental medicine, which includes Chinese herbs, and we have other techniques that we do with the acupuncture also, like the biomat.
The biomat. I got addicted to the biomat this past, I think it was winter, spring. And I encourage everybody to. And what does a biomat actually do, though, Megan?
So,
I mean, I use it basically for the relaxation and some. I know there's crystals involved and all that other stuff, but tell us more about what the component for the biomat.
The technology has been developed over many years. The far-infrared wavelength, it works synergistically with acupuncture, or it could be used separately from acupuncture. With every treatment, we have far-infrared lamps that we put over different areas, but the whole mat is far-infrared that comes up into your body to reduce inflammation and help with tissue regeneration. And it's basically can heal just about everything. And then combined with the acupuncture, we get this amazing synergy. They've found that cancer doesn't like this wavelength, this certain vibration. So it's a really wonderful addition to any treatment.
Right. So I just want to say before we get into really what Megan does, and there's a lot, that you are located where?
So I'm located at Stonington Natural Health Center, which is about halfway between downtown Mystic and downtown Stonington.
Right.
A half mile from the Big Y, across from Cove Road at Quambog Cove. It's
can't miss it.
107 Wilcox Road, Stonington.
Okay.
Yep.
So when you were talking about having gone to school for pre-med and everything, and what followed that, does every acupuncturist out there have to do that same schooling, or is this something that you've really kind of gone above and beyond what is necessary?
Well, every acupuncturist has different specialties, and so yes, we need to have a pre-med undergrad, and then with the graduate school, it can be 3 to 4 years. I stretch it over 4 because there were so many classes that I wanted to take when I was out in Portland, and then I continued to actually go back to school. I stayed in Portland, and I had a practice there for 4 years, and I just kept going back to school because the teachers were amazing. Then after school, along the way, I continued studying with Dr. Richard Tan. I do the balance method with acupuncture, which is my favorite style. I've studied many different styles, and with the balance method, we don't put the points in the area where the problem is. We do points, it's a really ancient style, where we do points that circuit up through the brain and to that area. Basically, the points are buttons that reprogram the body. And Dr. Richard Tan, he brought it out of the ancient texts. He has an electrical engineering background, and so he sees these as buttons, and these are just ways to hold down the buttons, get the body to reprogram itself. I've also studied in China, the Chinese herbs. I studied there. I was there for a month doing intensive study. And then fertility is another specialty of mine, which I studied up in Boston with a specialist in Boston. Another specialty that I have is acupuncture facelifts, which I studied with Virginia Doran, and she was the pioneer who brought that to the U.S. She was the first one to bring that to the United States.
So the acupuncture, I'm interested, okay, in this acupuncture facelift. So we have to spend just a few minutes on this. And so is it mainly men and women, midlife? I was going to say my age. Refuse to say that. Or is it younger? I mean, how does, who comes in to see you for?
It's fascinating because I do get all ages with that. I get teenagers that might have acne or other skin problems, and their face starts clearing up with the acupuncture facelifts. So they're coming for the increase of circulation to the face. I have people who have lost weight and they want to firm things up. I have people that might have more going on, and we're able to, like artwork, fade any lines, lift, define the face more. I have people who have done Western techniques and want to do something in addition, or they don't want to do the Western techniques anymore. I have people that never want to do the Western techniques and
so is this something that you have to constantly keep up, or, I mean, I know you have a whole series that you do.
Yeah, so most people, people can come in every once in a while for it. You're going to have benefit from just doing that. If there's a goal with it, often they'll do a series for 4 to 6 weeks. And then once they get to where they want to be, sometimes people will repeat if there's more that they want to get to. Then once a month for a tune-up is recommended, and it just keeps things going as they ended.
Right.
Yeah.
And so, I mean, with these types of facelifts, you see a lot in the news about, the different chemicals and people having reactions and things like that to, plastic surgery. And so with this, you don't have to worry necessarily that you might have a bad batch of whatever. You're just doing it naturally, and you don't.
Exactly. Yeah.
Nice relief.
Yeah, there's nothing in the needles. People always ask that because sometimes they get so relaxed, and so they're like, is there something in the needles? Nothing at all. It's just the way that the body takes the signal and then responds to it, which is it's going to be releasing endorphins, which are incredibly relaxing, as well as balancing biochemistry. All the treatments do that for the body, whether it's to help with mood or hormones, or for the acupuncture facelift, we do a full body treatment, the regular treatment, with the facelift points in addition to those.
Right there, Tricia. I know I've been just focusing on this acupuncture facelift, but I recommend.
Well, I think we need to go do it, and
yes,
then we'll
I
have
think
a
we do.
closer Mystic Matters.
I really think, but we won't do it right away. We'll do the 4 to 6 weeks, okay?
Yeah.
We'll do that treatment, then come back.
You'll see us at the end of the summer.
Exactly.
One thing I have a question for you about with the fertility, and if it was used for treatment of acne, and even if you had an injury, do you work at all with any insurance companies? I know that some are starting to lean towards covering things like this.
There are many plans that reimburse for acupuncture. As acupuncturists, we have a hard time getting on panels often. And so the way that we do it in Connecticut, most of us acupuncturists, is we have the patient pay at the time of treatment. We give the form. They send the form in, and then they get the check directly sent to them, and the reimbursement happens quicker that way. They get more reimbursement that way. So that's
but hopefully that, I mean, as insurance just changes, I mean, it's a sort of a moving target at this point. Hopefully that changes for this type of method, the more natural way.
Yeah.
Megan, how long have you been practicing? I mean, I've known you a long time, but how long have you actually been practicing?
So let's see, I started practicing in 2000, so.
A long time.
Yeah.
Yeah.
How many, 14 years?
Right.
Oh my gosh.
Right, and you settled in this area and opened up your business in this area.
I moved back east in 2004 and
Okay.
then opened Stonington Natural Health Center in 2005, and I was practicing getting going, and then opened Stonington Natural Health Center in 2005.
And there's other things that you offer, obviously, beyond the acupuncture and the Chinese herbal medicines. It looks like you have these talks that are coming up that are kind of run the gamut in terms of what could be, affecting you. And tell us a little bit about how you decided which talks to do and
Sure.
how people can get involved in that.
Yeah. Well, I'll mention that the next talk, which is Tuesday, July 22nd, is on pain relief, and incorporated in the regular treatments, we call them regular or full treatments, there is a massage. With the acupuncture facelifts, I do a massage of the face afterwards, but with the regular treatments, I have massage therapists that work alongside me as assistants, and so they do a massage at the end of the treatment. So with pain relief, on July 22nd, the talk on pain relief, we'll talk about how acupuncture helps with pain relief, herbal formulas that can help with pain relief, which actually I brought one of the favorites, Corey Dallas. I get people off of everything from ibuprofen, Tylenol, all the way up to Percocet with Corey Dallas. No side effects, not harmful to the stomach, liver, or kidneys. And it's just a miracle. It's a favorite. People just always like, where's this been all my life? Because you get them off of other things.
Right, but even for a headache or a back pain, or they'll say, take some ibuprofen before you go to bed. So something like that, which I've taken, by the way, really helps.
Thank you.
I can tell you this helps. And I take it at night, and so so it's a more comfort level in sleeping, and the next morning you're not dealing with a stomach issue, or knowing that you're putting something crazy in the body that's going to affect your liver or kidney.
Yeah.
So that's great.
And even after working out, when you feel a little bit achy, a couple, or
Trisha,
there you go. I need the mask, the facial. I need it all.
And the Coriolis, just for
even menstrual cramps.
Yeah, this is actually a miracle drug. I mean miracle. I don't call it a drug. Herb. Yes.
Yeah. Another one that we have a talk August 19th is on memory, focus, concentration, ADD, ADHD. Just August 19th, I chose prepping people for going back to school. We have herbs that can help, but the acupuncture is phenomenal. I have parents that will bring in their child before leading up to the SAT or a big test, and they notice the test scores being better because the acupuncture can help with brain circulation and calming, feeling more calm so they can focus also. I've helped get kids off of ADD drugs also, although I don't ever take anyone off a drug. They figure out when they're ready to come off it.
Right.
So when it's the talks, it's more of like an informational session where anybody that feels like this might be something that pertains to them, they would come and you kind of outline the whole program, what the different treatment options are, and then from there they book with you the sessions.
Yep, and it's an hour-long free talk. Come with questions. They're very interactive. They're a lot of fun.
And this is right at the studio, right at your business, okay?
Yeah, right at the center. Boost Your Immune System on September 23rd. I brought one of our favorite herbal formulas for zapping bacteria and viruses of the upper respiratory system, Ilex. The Chinese, the Chinese, they have got it down. I mean, these formulas have been worked on for hundreds of years, fine-tuned, so that they can work on whatever level the illness is at. and they don't mess with the internal biochemistry, unlike an antibiotic that can kill the good stuff. The herbs don't do anything bad, so it's a really nice thing. It's definitely recommended to come in and talk with me about it, though, so we make sure to choose the right herbal formula.
Right.
Yeah, I brought in some other fun things, like we have an all-natural sun protection. So did you ever get this one?
Yes, my sister actually purchased that for me because some of the medications that people are on, they're not allowed to be out in the sun, and that's great. That's fabulous.
Yeah, actually, it allows you to tan, but you don't burn.
Right.
And it's because it super antioxidizes the cells.
Yeah.
You have to apply it a little bit more frequently.
You
but
do.
That's all right.
Yeah, that's fine. Yeah.
And it helps after sunburn too.
Like this is a great
should
product.
have used it more after this past weekend.
I was going to say, Maggie, you got a great tan.
Oh, thank you. So those are some goodies. We have organic vitamins. We have herbs that help with sleep. A lot of people have sleep problems. The Heavenly Emperor formula is one of the two. Ardisia can also be helpful for that. Ardisia calms the mind and helps with anxiety. Heavenly Emperor is like when there's kind of adrenaline going on, like you've been busy all day and like your body's like, I could stay up all night. And then in the morning you're regretting it. But so you take this and then you actually can.
So is there one preferred than the other? I mean, is there one that you would recommend for somebody that like every night can't go to sleep? Which one would that be?
So I would ask them, like, are you thinking about things? Like, you going over your day?
Yeah.
That's Ardisia. They're fine to take together, too.
Yep.
But Heavenly Emperor often is if they're having disturbing dreams, because it's that adrenaline that's doing that.
Yeah.
Or if, like, in the middle of the night, they get this spike and they wake up, like, at 2 a.m. That's because during the day, there's those cycles. This just, it calms that. There's no harmful side effects with these. They actually are like what the body needs. So like this is just mellowing out the adrenaline, mellowing out the cortisol so the person can just stay asleep and you wake better rested, you wake awake, you wake well rested with this. So like last night I took one of these and 2 of these actually.
Right. But can they get on a basic regimen to take both? You know, and it doesn't harm?
Nope, no harm. The Ardisia has a lot of minerals in it. The minerals are really calming to the nervous system and better than just taking like a calcium and magnesium when you're focused on calming. The herb directs it to the heart and directs it to the nerves to soothe the nervous system.
Okay, that's interesting to know. That's good. Yeah.
One of the things I wanted to go back to, you had mentioned the fertility acupuncture, and I was wondering, now is that both women and men that come together, or you treat them separately? I mean, is it just for women?
Oh, good question.
Yeah,
good
I
question.
treat both. So I treat men, especially low sperm count or impotence problems. That's great with the acupuncture and the herbs. With women, when both, it's a couple and they're both coming in, even if one person is told they don't have anything wrong, like the acupuncture helps them to sync up better, because fertility is all about the DNA connecting. And so sometimes one partner will say, oh, I don't want to go. And that's fine. We'll get the other person as boosted and as ready as possible. But if we get both, it's
even better.
It's even better.
Yeah.
And with women, I again treat a huge range of ages, all the way from 20s. You'd be surprised how many women in their 20s are having fertility issues, all the way in through the 40s. I even treated a woman in her early 50s at one point. So I'm really amazed with the fertility, and then there's this wonderful end product that you get to
absolutely.
see.
Yeah, absolutely. So what other specialties, Megan? Because I know you have a range of specialties. You do.
So let's see. Menopause is one. Depression, anxiety, definitely help a lot of people with that. Pain relief is very motivating. When someone's in pain, like that's when I usually get a lot of people for the first time, and then they're like, wow, that helped with that. Can it help with this? Can it help with my digestion? IBS, skin problems. Trying trying to think of all the things. Addiction, quitting smoking cigarettes. I have advanced training in that also. Part of my schooling was working in drug detox centers out in Oregon that do the ear acupuncture. While I wouldn't just take someone on, I'd want to make sure they're getting counseling somewhere else. It's a great complement to that. As well as when someone's coming off of a medication, the ear points can help them make that transition a lot easier also.
Now, I've been to your facility, the center, several times, and sitting in your wonderful, I could fall asleep just in her little waiting room. Could you?
Very nice.
You just want to sit there, and you really don't want to talk to anybody, but I will tell you, it is a community place, so I do run into a lot of wonderful people, and that's what I was going to say about you, Megan. You just have a facility where I think it's not only the community, but I see so many people with so many, whatever they're there for, but they come out with the same result. Just want to come back, and see Megan. So I guess, what I'm saying is you have hours that you do appointments too, right?
Yeah,
so you kind of adjust.
Yeah,
adjust.
we're as accommodating. We have hours that are during the day. We have hours at night because we want to get people that can, so they can come after work. We have all different prices of treatments because we want to accommodate people with all different budgets. So we also have massage on its own too for being able to come in, even for just a 10-minute massage, you can stop in for that. You can stop in for herbs. You can come in for just the biomat. So we have a whole range.
And you can sort of do a consultation and work with that person's need at the time, and then come up with a price and work in a schedule for that. So you're really building this sort of specialty medicine for this, for the patient, and that's I think what you're best at.
Thank you.
And so now you're the do you have another acupuncturist on staff, or are you the only acupuncturist?
I'm the only acupuncturist.
And then you have massage therapists.
Okay.
That come in too. Yeah.
Right.
So you're pretty busy.
Yeah, pretty busy.
So you have the next lecture is October 21st, and it's wine, women, and menopause. Let's just talk about the wine.
Well, we should
first.
Memory is the one you skipped because there's
three
other.
Well, the memory was sort of with the ADHD. You know what, I think I'm going to come for August 19th and then skip right over to October 21st. But, I never think of the memory thing, but I guess that's an important part too.
Yeah, memory. I have people who come in, even, memory to help with tests and exams we talked about. But I also have the other spectrum where I have people that come in that might be starting to have dementia.
Yeah.
And we can...
I think that's where I'm coming from.
We've had some fascinating things because often I have a lot of couples that come to see me, actually, and they both come and get treatments at the same time, and they'll report back to me on how the other person is doing, which is so sweet.
Yes.
I love that.
Yeah.
And noticing that their spouse or their partner is improving in their memory or having a better mood, it's really fulfilling too.
Yeah.
So you almost fill the role of a therapist on top of everything else by just having to take in and really listen to what somebody's saying and what's going on, and then go over everything.
Definitely. And family doctor. I mean, that's what, I'm not a, quote, family doctor, but in China, the acupuncturist... Well,
actually, you are. In a way, you are, which is great, Megan. And we just have a few minutes, and both Tricia and I have been to this center. I've been there recently. There's some beautiful, the way it's set up, it's beautifully designed. You have your fall, your winter, your summer rooms, and I just encourage people, if they just want to walk into 107 Wilcox Road, Suite 103, to the center and just get to know whoever is the receptionist, if Megan is busy, and pick up some of the information that's right there at the reception desk, and you can make your own judgment. But I do guarantee you, once you walk in and get the feel of the center, you will be back to see Megan Marco and her crew. So she's at the Stonington Natural Health Center at 107 Wilcox Road. You've got it up there, her website and her phone number, and I encourage everybody to come see you.
Thank you for
and thank
coming.
you so much, and I know you'll be back again. And
we'll be back too.
Yeah, and maybe 4 to 6 weeks, maybe not from now, maybe after Art Festival, you'll see a little bit different.
We're going to be new people.
Suzette and Tricia, and also with a better memory. Okay, we are Mystic Matters. Good evening.